Hello, and thank you for joining our presentation today, Master 2, Multiple Auditory Steady-State Evoked Response. In this brief introductory presentation, we will cover what is the ASSR and how is it measured. We will review stimulus characteristics, and we'll discuss clinical applications including advantages and perhaps disadvantages to including ASSR in your clinical test battery. The ASSR is an auditory evoked response which is elicited by modulated pure tones. The Biologic Master 2 ASSR software is a valuable addition to the Navigator Pro AEP platform. The Biologic Master 2 uses clinically validated response detection technology. The software in Master 2 was developed by Dr. Sasha John and Terence Picton. With the Biologic Master 2, audiologists are able to test either one ear or both ears simultaneously with up to 4 frequencies. Multiple montage choices are also available. How is the ASSR similar to an ABR? With ASSR, we continue to use surface electrodes, and of course it's an auditory evoked potential. Patient state is very important with ASSR, as it is with ABR, and neural synchrony is important as well. ASSR differs from ABR in that it utilizes objective response detection technology. There are no waveforms to interpret. With ASSR, we can test both ears at the same time, if we choose, with up to 4 frequencies in each ear. And perhaps one of the most significant differences with ASSR is the stimulus. ASSR utilizes modulated pure tones as opposed to clicks and tone bursts. The stimulus in ASSR is called the carrier frequency. The carrier frequency is comparable to the frequencies on a standard audiogram, 250 through 8,000 Hz. Mid-octaves are available with ASSR testing and the Master 2 software. The carrier frequency for ASSR testing is altered by modulation. What type of modulation? There are several types. Amplitude modulation, frequency modulation, mixed modulation, exponential modulation, and the modulation is also defined in terms of its depth and its rate. We'll discuss each of these in a bit of detail. Modulation alters the carrier frequency to allow for measurement of an electrophysiologic response. Modulation is used because electrophysiologic responses cannot be measured from continuous pure tone stimulation. We'll talk a bit about modulation type: amplitude, frequency, mixed, and exponential. Amplitude and frequency modulation simply changes the amplitude and/or frequency of the carrier frequency over time. We have 2 examples here. In the first example, 100% amplitude modulation of a 1000 Hz carrier frequency. And in our second example, 50% frequency modulation of a 1000 Hz carrier frequency. When we combine amplitude and frequency modulation, we have mixed modulation, and in this example, we have 50% amplitude modulation and 20% frequency modulation of a 1000 Hz carrier frequency. Mixed modulation is very useful for ASSR testing, as studies have shown that when using mixed modulation stimuli, the amplitude of the ASSR response is increased at mostly all the frequencies that we're testing. Modulation is also defined by percentage and rate. Modulation percentage is the extent to which the modulation is performed, and it applies to both amplitude and frequency. Modulation rate is the speed at which the modulation occurs. Modulation rate is expressed in hertz, and it's referred to in the software as the modulation frequency. It's very important not to confuse the terminology modulation frequency and carrier frequency. Carrier frequency is the stimulus. Modulation frequency describes how often the modulation occurs with that carrier frequency. Back to our earlier example, we have a 1000 Hertz carrier tone with amplitude modulation, and in this example the modulation depth is 100%. In our second example with frequency modulation, the modulation depth is 50%. In these two examples, what is the modulation frequency, or the rate of modulation? It's not shown on this slide. This is an example of modulation frequency, a 1000 Hertz carrier frequency with 100% amplitude modulation. The rate of modulation, or the modulation frequency, is 85 Hertz. This carrier frequency is turned on and off 85 times per second. The modulation frequency is important because the electrophysiologic response of interest, the ASSR response, is the neural activity that corresponds to the modulation rate of the stimulus. Using unique modulation rates for each frequency allows for simultaneous testing of multiple frequencies in one or both ears. For example, if we're testing with binaural stimulation and we are using 4 frequencies per ear, the software will utilize 8 unique modulation rates, one for each carrier frequency. In the Master 2 system, the default protocol includes 500, 1000, 2000, and 4000 Hz presented to both ears at the same time with mixed and exponential modulation, 100% amplitude modulation, 20% frequency modulation, with modulation frequencies that range from 75 Hz to 105 Hz. All of these settings can be adjusted by the user as desired. Here's another example of 4 frequencies with modulation frequencies ranging from 77 to 101 Hz. 500, 1000, 2000, 4000, and when we combine those 4 stimuli, and that is the signal that your patient will hear during ASSR testing. Keep in mind, if you've done an ABR on a baby and they have normal wave 5 latencies at low intensity levels, say 20 or 30, you might want to start ASSR testing at 30 or 40, but not much higher, so as not to wake the patient before the test is complete. In the Biologic Master 2 software, the ASSR is measured by analyzing the frequency content of the incoming EEG signal. In this slide we see an incoming EEG, which is what we're used to looking at with our ABR test, and off to the right we see the amplitude and frequency spectrum of that incoming EEG signal. The yellow spikes that appear on the graph on the right indicate the activity that's present at the modulation frequency of each carrier frequency. With the Master 2 software, the information in the incoming EEG signal is collected in 1-second epochs, or snapshots of information. 16 epochs equals 1 sweep. The FFT is performed on each sweep, analyzing the frequency content. A statistical analysis occurs in the background, and a score is assigned. As each sweep is collected and analyzed, the score is updated. That score is called the p-value, which is the statistical confidence value indicating the presence of a response. The software allows users to define custom stopping criteria. The default settings are similar to what you might see with an ABR test. For example, with ABR, you may choose to stop collection at 2,000 sweeps. With ASSR, the typical stopping criteria for sweep count is set at 32 for most intensities, a little longer for lower intensities, a little shorter for the highest intensities. These values can be adjusted by the user. We also have stopping criteria based on p-value, based on that statistical confidence score. A p-value of 0.049 or better indicates a 95% or greater likelihood that a response exists. The software will stop collecting at individual frequencies if that p-value is reached with a minimum of 7 sweeps, with 4 in a row, maintaining that criteria. Again, these settings can be adjusted by the user, although p-value criterion cannot be made less stringent. 95% is the cutoff. The software shows responses during collection, conveniently with colors red, yellow, and green, red indicating no response, corresponding to p-values of 0.1 or higher, yellow indicating a marginal response with p-values of 0.05 to 0.1, and green indicating that a response, a statistically significant response, is indeed present, and that corresponds with p-values of 0.049 or better. As mentioned, there are automatic stopping criteria based on sweep count and based on p-value criterion. Users can also stop individual frequencies at any time they choose. They can create their user-defined stopping rules for automatic stopping of collection, and users can also define corrections to estimate the audiogram. The default correction factor is 10 dB across the board for all frequencies. So for example, if the lowest level that you achieve a statistically significant response is 40 dB at 1000 Hz, behavioral hearing thresholds would be estimated at 30 dB or 10 dB less. With the Master 2 software, users can utilize 1 or 2 channels for the recording. Of course, a 2-channel system is required if you choose a 2-channel recording. The user interface is similar to the Biologic Navigator Pro software. Multiple montages are available, the database is shared with the Navigator Pro, and reports can be customized in the same manner as they can be with the ABR system. Perhaps the most common montage for ASSR testing is a single-channel, binaural, linked ear montage. What does that mean? We're testing with one channel. The non-inverting is high forehead, common is low forehead, and the inverting electrodes are the ear level electrodes. The electrode on the right ear and the electrode on the left ear are connected to the jumper cable, which is placed into input 2 of channel 1. A clear description of this montage is in the user manual. Another choice would be single channel monaural stimulation. This montage is the same that you would see with the Navigator Pro. Electrode switching is enabled. High forehead is channel 1 input 1. The common electrode is the right ear. Channel 1 input 2 is the left ear. With electrode switching enabled, the common and the input 2 switch based on which ear is being stimulated. It's important to remember that with this montage with ASSR, you're only stimulating one ear at a time. Some users may prefer to continue using the nape of the neck. This was something that was used in the original version of the master software. If you're using the nape of the neck as your inverting electrode, your high forehead is still your non-inverting electrode, low forehead is ground. Electrode switching must be disabled if you're using this montage and only stimulating one ear at a time. Electrode switching is disabled by default in the application when both ears are being stimulated. There's also a 2-channel option for montage, and this is the same 2-channel ABR montage that you would use for an ABR evaluation. As mentioned before, the Biologic Master 2 software is very similar to the Navigator Pro AEP software. In the collection view, this screen may look a little busy at first until you understand all of the different sections. I'll first direct your attention to the left-hand side of the screen where you'll see 2 tabs, one that says Audiogram and one that says Details. We're in the Details screen right now. At the top left-hand portion of the screen, you'll see the incoming EEG signal, and at the top right, you'll see the amplitude, frequency, spectrum of that incoming EEG signal. We see details of the results along the bottom of the screen, the left ear and the right ear, with results for each individual carrier frequency. Red, yellow, and green clearly show up on the screen, and those correspond to the p-values for each of those carrier frequencies. We'll look at that in a little more detail in a moment. If you choose the audiogram view, this is what you'll see on the screen, and by hovering on the points on the audiogram you can get more details about the collection, p-value, number of sweeps, noise, etc. When you're setting up your protocol, if you choose Advanced Stimulus Setup, you'll see all of the details about the stimulus for each ear, including the modulation type, percentage, and the modulation frequencies for each carrier frequency. To choose different frequencies, you simply pull down the drop down next to the frequency and you'll see all of your choices there. Back to the collection screen. During collection, it's important to pay attention to the values in the boxes along the bottom of the screen. Response amplitude, noise amplitude, and p-value are clearly shown for each carrier frequency, and this information is updated with each subsequent sweep. Response amplitudes that climb and noise amplitudes that drop are usually associated with p-values that approach 0.049 or better, thus indicative of a response at that intensity. However, while you're watching the screen update, if you notice that your response amplitudes are not climbing and your noise amplitudes are low and your p-value is not approaching 0.049 or better, it's not indicative of a response. You can stop collection and move on, perhaps at a different intensity level. So in order to optimize time during your ASSR test, it is important to watch the values in this screen with each subsequent sweep. Once you're done collecting your information, there's an X at the upper right corner of the collection window. You choose that X to enter the analysis window. In the analysis window in the center of the screen, you'll see the audiogram table. Off to the right is a choice Autofill. By selecting that, the software will automatically choose the best response for each carrier frequency for each ear. You can then apply the correction set if you choose. Once you fill that audiogram table, if you've chosen the correction factors, the manufacturer default will use 10 decibels across the board. This table can be customized if you choose to collect your own normative data in your clinic. Once you've filled the audiogram table, you can look at your results in the audiogram format. In this case, we can see an audiogram for each ear. You also have a choice for one graph combining the ears. Advantages to utilizing ASSR: of course, you can use simultaneous stimulation and higher stimulus levels. The software uses objective response detection, eliminating error in interpretation of waveforms, and test time can sometimes be much faster with ASSR because you can collect information on multiple frequencies at the same time. However, patient state and ambient noise are critical for ASSR testing. We're measuring responses in nanovolts, which are 1,000 times smaller than microvolts. The ABR waveform is measured in microvolts. The ASSR response is nanovolts. So patient state is very important. If patient state is not ideal, if there's increased ambient noise in the test environment, test time may be prolonged. In summary, the Biologic Master 2 system is very frequency specific, using objective response detection with high sensitivity, greater than 95%. It's useful for cases where a reliable behavioral audiogram cannot be obtained, and the ASSR thresholds closely correlate with the behavioral audiogram results that may be obtained later. And finally, with ASSR, higher stimulus levels are available for testing for those patients with severe to profound hearing loss who have no response to ABR at 90 or 95 dB NHL. ASSR allows you to test as high as 119 dB HL. The report can be customized in a similar fashion as the reports in the Navigator Pro software. For more information, please visit our website at www.natus.com. Our Nerve Center contains several other e-seminars that you may find of interest. Thank you.